I'd like to welcome everyone to Control the Migraine, a Mind-Body Medicine Network production with Bonnie Groessl, MSN APNP, that stands for Nurse Practitioner and Holistic Coach. And we're so excited to have all of you with us for this webinar. This webinar will be recorded, so you'll be able to go back to this, listen to it, enjoy it, and gain a lot of information and wisdom from Bonnie Groessl's presentation. So in order for everyone to have just as enjoyable and enriching an experience as possible, we're going to go over the technical aspects of the webinar first, and that way you won't have to worry about anything not working. So I am going to be assisted by a wonderful world-class producer, Heather Butts, of Learn for Life Consulting, LLC. And Heather will be responding to any technical issues through the chat area throughout the webinar. And we'll talk a little bit about the chat area in a few moments. Now, when Heather responds, you'll be seeing the name Bonnie Groessl, but that's really Heather sharing what to do if you have any technical issues. So that will happen throughout the webinar. You can ask any technical questions to Heather. Bonnie and I, Ed Glauser, the host and also owner and clinician with the Mind-Body Medicine Network, will respond to questions, comments about content, feedback at the end of Bonnie's 60-minute presentation. So we'll have a good 20 to 30 minutes for discussion through the chat area during the last part of the webinar. So let's go over the control panel first, because that's where you see the logo of the Mind-Body Medicine Network. You see Bonnie Groessl's picture. So the first thing is you'll see a down arrow next to the word host. So go ahead right now and click on that arrow to minimize that part of the screen. And now you have a much bigger chat area. And also you'll notice on information where it says dial in. So you're welcome to listen via your telephone, smartphone, or through your computer, laptop, or iPad. To hear the audio through the computer, you want to click on that listen icon. And if you do that, since you'll be commenting through the chat area, you really don't need to use your phone, and that can save you some phone charges. So if you have to leave the webinar for any reason, it will be recorded and sent to you within the next 48 hours. And the recording is for your use only. For other people, we do charge a fee, and they can go to my website, the mindbodymedicinenetwork.com website. And the other thing is you'll notice ask a question. We're going to ignore that area, so everyone's just going to be in the chat area where you'll type all your comments, questions, but not in the ask a question area. We won't be utilizing that. So before we hear from Bonnie, I'm going to briefly turn it over to Heather Butts, our producer, and she's going to share a little bit about her role with you and some of her background, and a little bit about Learn for Life Consulting. So Heather, thank you for being here. It's because of you that I have become a better and better webinar host, because of your how to host successful webinars on your different programs. You're a stellar friend, professional, and I'm thrilled to have you. Welcome, Heather.
Well, Ed, thank you so much for that beautiful introduction, and I feel exactly the same way. And I just did a webinar for another company, and I was talking about how Ed really has become one of those people where I feel that the student has has surpassed the teacher, so to speak. So it's a pleasure to be on this webinar with all of you, and Ed, thank you so much. And I I can assure you that you're in for a real treat tonight with Bonnie Groessl, because she is a consummate professional, and the information that she's going to give you tonight is going to be really outstanding. So just briefly, my company, Learn for Life Consulting, we work with individuals who want to either create or enhance their online presence, and we work with companies and entrepreneurs who either already participate in webinars and online education or want to actually start doing that kind of work. We can also help with training and help with the process of enhancing that program. And again, thank you so much for giving me the opportunity to be here this evening, and I'm looking forward to a really wonderful webinar. And back to you, Ed.
Thank you so much, Heather. And for those of you that want to contact Heather, you see her website, www.learnforlifeconsulting.com, and we're thrilled to have her with us. So before we introduce Bonnie and control the migraine, I want to tell you a little bit about the Mind-Body Medicine Network. So the Mind-Body Medicine Network is dedicated to fostering communication and educational understanding of the role of mind-body medicine in biomedical and behavioral health care among clinicians, educators, research scientists, and the lay public. Participants in MBMN are urged to seek professional care for any medical or psychological concern or condition, as the MBMN online platform is not a substitute for official diagnosis or treatment by a licensed professional or clinician. The MBMN network operates a listserv for the professional and lay public to share information throughout the year that's free of charge, that will promote the efficacy and expansion of mind-body medicine in healthcare and other allied professions, as well as offering webinars like this evening, online training, and certification programs on sleep health, pain, and stress relief. So to find out more about the Mind-Body Medicine Network, that's the link right there on the slide on the bottom, and you'll see a wonderful, rich array of webinars for 2012 and 2013. So now we're going to talk about migraine control. So first of all, this program does not intend or imply to be a substitute for professional medical advice, diagnosis, or treatment. So different things work for different people. And although the tools and strategies, including in migraine control, have helped many people, everyone is different. So it is now my pleasure to introduce to you Bonnie Groessl. And before Bonnie starts with her presentation, which you will thoroughly enjoy, I want you to know a little bit about Bonnie personally. I met Bonnie at the last National Institute for the Clinical Application of Behavioral Medicine conference. We were in a 2-day training together, Unlearn Your Pain with Howard Schubner, MD, and we just struck up a wonderful friendship. We have so much in common, and Bonnie has been like a teacher, a mentor to me in helping me establish the Mind-Body Medicine Network. So she is integral in this process, and this is actually the second webinar she has done for us. The first one was on creating blogs to virtual clinical practices, and I listened to every word she said, and as a result, I established the Mind-Body Medicine Network. So let me now share a little bit about Bonnie's background. Bonnie is a nurse practitioner and holistic coach. She is board certified by the American Nurses Credentialing Center as a family nurse practitioner and has additional training in integrative medicine, mind-body techniques, energy work, as well as headache and chronic pain management. Bonnie owns the Bridge to Health and Integrative Healing Center. She has recently taken her practice to the virtual world at www.bonniegroessl.com. And for those of you that are not on a computer, Bonnie Groessl is spelled BonnieGroessl.com. So she has been reaching people across the globe with webinars, coaching, and just wonderful membership programs. The Bridge to Health has a Facebook fan page and a blog talk radio show every Monday at 4 p.m. Central Standard Time. So you can tune in tomorrow and hear Bonnie. Her YouTube channel, Holistic Pain Relief, features Migraine Minutes, a series of short videos with tips for headache and migraine sufferers. And I watched all of Bonnie's Migraine Minutes, and they are absolutely wonderful. You'll get so much benefit out of that, and it just takes minutes. So Bonnie is also recognized as an expert in helping people to make changes to achieve their goals. Her focus is on providing an integrative, holistic approach to people with chronic emotional and physical pain. Clients learn tools that bring together mind-body medicine, nutrition, energy medicine, and spirituality to help them enjoy the lives they deserve. Bonnie is also active in public speaking and presenting workshops for professionals and the public. Her guided meditation CDs are available worldwide and as digital downloads. And I must share one of her CDs on sleep health I used during a very stressful time, and I improved dramatically in being able to allow the sleep to come. I was restored. I felt so much better. So Bonnie is extremely effective. Also, Bonnie has a book out. Her first book, The Choice is Ours, 5 Keys to Health, Happiness, and Abundance, teaches some of the tools she uses in helping people achieve the lives they want. And I think I'm Bonnie's biggest fan, and I'm so excited because you all are going to become great fans of Bonnie Groessl. Bonnie, welcome.
Thank you so much for that wonderful introduction, Ed. I so appreciate it. I'm excited to be here, sharing information and insights into this debilitating condition we call migraine. I mean, it's so important and affects so many people. So it's an honor to be here. Thank you.
It's my pleasure. And so we will go on where you can talk about what we're going to be learning during our webinar.
Awesome. Well, what we're going to be talking about on today's webinar is the overview of migraine and its socioeconomic impact, to at least set the stage for that, and then how people can use their own healing abilities to control migraine and reclaim their lives, and most importantly, how you can help them, those who suffer with migraine. We're going to learn how we can help to empower migraine sufferers to reclaim their lives by discovering these things: lifestyle issues such as nutrition, hydration, and stress, and how that plays a major role in migraines. How to journal migraines effectively, and why it's so important to track the things that no one talks about, because if you don't, it could actually be worse for you. The impact of learned associations and how it keeps people stuck in the cycle of pain. The power of the mind-body connection and how it can change those learned associations. And plus, that's where you have all your own drugs. How stress management can be your trump card in dealing with migraines. And then we'll learn today simple tools that you can share with migraine sufferers to enjoy a better quality of life. So migraine is so common. There are over 30 million migraine sufferers in the United States alone. That's a lot of people. And about 70% of those sufferers are women. And that's primarily because of the hormone association. 91% of migraineurs miss work or can't function normally during a migraine attack. So it's really debilitating. And now this is the scariest statistics. Depression is 3 times more common in people with migraine or severe headache than in healthy individuals. And really that's with any chronic pain. The prevalence is about twice that of diabetes, which is very common, but migraine is twice as prevalent. And very often migraine gets misdiagnosed, at least initially, as a tension type headache or a sinus type headache, and we'll talk about why that is. Migraine is multi-mechanistic. There's a lot of things going on here. Vasodilation, inflammation, edema, and the nociception, which is the activation of the pain receptors. And pain is experienced long after these mechanisms are in place and initiated. Migraines can last a long time, as we'll talk about in just a moment. Peripheral and central neuronal sensitization can lead to refractory migraines and that chronic daily headache. And the treatments that we have, at least the traditional treatments today, really aren't adequate to address all of those mechanisms. So it's been difficult to treat the migraine sufferer adequately. Migraine can be felt in both sides of the head, bilateral or unilateral. We used to think it was really just unilateral pain, but really because of the nerve pathways, it can be bilateral as well. And the same nerves that carry migraine pain also go to the sinus area, so sometimes people think they're having sinus headaches. That can have facial pain or pain around the eyes. And it also can cause some stuffiness or a runny nose. The turbinates of the sinuses actually become enlarged and inflamed when you have a migraine. And then there are nerves that can cause neck pain. These are also activated during migraine. Pain can be referred to any of the three branches of the trigeminal or the cervical nerves. So pain can be received then on both sides of the brain, on both sides of the head, around the eyes or sinuses, and the occipital area, the neck area. So people don't always know initially that it's really migraine. So why are migraines often mistaken as menstrual headaches? So largely that has to do with the hormonal association. Migraines become more prevalent among women than men after the onset of puberty. Before puberty, it's about the same statistically. Hormonal fluctuations associated with the menstrual cycle, perimenopausal time, even menopause, dramatically change headaches throughout a woman's life. So for migraines, sometimes temporarily go away a bit in pregnancy. Generally, it's the second or third trimester. Sometimes the first trimester can actually be worse. And there are some unfortunate people that have their migraines throughout their pregnancy. And then menopause, another major hormone shift. About 70% of women whose headaches are, whose migraines are really associated to their menstrual cycle, about 70% of them do get better with menopause, and about 30% get worse or stay the same. In terms of sinus headaches, because pain can be felt around the face, the eyes, the sinuses, and are sometimes aggravated by weather changes or allergies, it seems like a sinus. And then tension headaches. I mean, stress brings on headaches in anybody, whether they have migraine or not, but it very often is a trigger for migraine headaches. So people mistake because of where it feels. Sometimes it'll start in the neck and radiate forward to the temporal areas, and it's usually at a time of stress. So it's very often mistaken for tension headaches as well. People will say, oh, it's just a tension headache, yet they're down in bed and out for the count. It's more than a tension headache. So now we've come to sort of this quick criteria for diagnosing migraines. The list used to be quite long, actually, and had all these, algorithm movements. But right now, we're just looking at three main criteria. Headache that limits activity or is worse with activity, nausea or vomiting, and sometimes this can even be a loss of appetite, and then sensitivity to light or sound. Two of these three criteria is diagnostically sufficient for migraine. And there's such variation between people. Sometimes I don't even see two out of the three. Sometimes if they have one and they're debilitated, even though they could have activity, but they just don't feel like doing anything, that's still limited with activity. So I still give them the diagnosis of migraine. Now, I think everyone should be evaluated, but there are some warning signs, even for people who already have a diagnosis of migraine, that it's important to make sure that there's nothing else going on. So a sudden onset of a new severe headache, sometimes it's called a thunderclap headache, and most migraine sufferers will tell you this isn't my normal headache. A headache that's getting progressively worse or is worse with exertion, and that's not typical for them. A headache after the age of 50 as the first onset. That's very unusual, primarily because of the hormonal component. And then headache symptoms that are associated with the headache, like drowsiness, confusion, balance problems, memory, weakness in the arms or legs, and then fever and stiff neck make you think of meningitis. So always get those things checked out. And if there are other members in the household having headaches too, carbon monoxide might always be something that you'd want to check as well. So the other associated symptoms of migraine are things like throbbing pain, light sensitivity, sound sensitivity, nausea or vomiting. Unilateral pain is about 60% of the time, but about 40% of people have bilateral pain. And for some people, it's really just in the frontal area, so it can really vary there. Blurred vision is another associated symptom, and about a third of people have an aura right before the headache hits. Generally, that's a visual aura, but can also have sensory components as well. We'll talk a little bit more about that. This is a drawing, I think it's a drawing, from the National Headache Foundation. Once a year, they run an art contest, and people submit their drawings and their paintings and their pictures. And this picture I chose because it really depicts what it's like for a young mom to be down in bed or on the couch in this case, little kids kind of trying to fend for themselves and be quiet so they don't wake up mom. If you notice, the deadbolt is bolted on the door to make sure that the kids don't get out, and play outside while she can't really get off the couch. This is very typical of what it's like for a new mom or a young mom to have a migraine. They just can't take care of their kids, and it's a horrible, horrible feeling. Now, this is an image of what the visual aura looks like. The zigzaggy lines, the scotoma, the little flashing things, the blind spot in the field of vision. And this is really what it looks like. You really can't see. It's not safe to drive, all those sorts of things. So this is just an image depicting that, and that's why I wanted to share it with you. So migraine attack varies from person to person. It also varies from migraine attack to migraine attack. But this is sort of a depiction of what the whole pathway could look like. So generally, not every time, but generally, people will have a prodromal period first, which can be anywhere between 24 and 48 hours before the actual migraine hits. And that's what you see in the blue. And this is when they just feel different. Maybe they're fatigued, or they're kind of irritable, or they just don't feel right. That's very common. Then the aura, for about a third of those people, have those aura symptoms. Generally, it happens right before the headache hits, right before the migraine hits, but some people will also have aura symptoms going into their migraine period as well. So then the actual headache, that intense throbbing pain that people get, along with all those associated features that I mentioned in the slide earlier, can last anywhere from hours to days. For most people, then, there's a post-drome period, in which I like to call it the hangover headache. They still have a headache. It's not as bad as the migraine, but they still have a headache, and they just don't think right. I always say the synapses just aren't working like they should. So you're just a little off. And this is very common. The whole process can last a few days to a few weeks, actually. And with people with chronic migraine, one migraine leads into the next, and because of this prodrome and postdrome, they just never feel good, and they feel like they have a headache every day. Now, kindling is really important, and a lot of people don't really give this a whole lot of credit. This happens in epilepsy or seizure patients as well. It's when a migraine attack occurs repeatedly, over and over again. It sort of sensitizes the brain so that over time it takes less and less and less stimulation to cause that same attack. It then becomes transformed migraine is usually the term that it's given. And if it's not, halted, it becomes chronic daily headache. And then the person can't remember the last time that they didn't have a headache. And estrogen will increase this effect as well. Rebound headaches are very common. And so what is a rebound headache? Anything that you take to relieve a migraine, whether it's prescription or over the counter. Any medication that you take to relieve a headache, if you take it more often than 2 to 3 times a week, can lead you into rebound trouble. And what happens is our bodies kind of get used to having that medicine there because we were taking it so often. And as the last dose of medicine wears off, it actually causes the symptoms to come back, creating a vicious cycle. This happens with other medications too, like nasal sprays is a good example. If you use a nasal spray too much, it will actually cause you to feel like you need to use the nasal spray. Rebound headache is very common, especially with over-the-counter drugs or medicines. And it can occur with any rescue medicine, especially medicines that people can get easily and take a lot of and don't think that they're really hurting themselves with, things like Excedrin. That's probably the number one medication in the entire world, probably, that's to blame for rebound headaches because it also has the caffeine effect. So be careful with that as well. The other thing that rebound headaches does is it decreases the effectiveness of preventive medicines, the medicines that we take every day to prevent the migraines. And then you're really, behind the 8 ball because it's really hard to get a hold of that if a person is stuck in rebound. So let me tell you a little bit about my story and why I'm so interested in migraine headaches. This is me and my 2 sons, who are all grown up now, but when I was really struggling myself with chronic migraine, I missed a lot of things because I think I had migraines first with my second pregnancy, as I recall, but I missed a lot of things, social things, Christmas time. I mean, it was horrible. I also had the visual and the sensory aura. I didn't just have the visual, but the sensory aura symptoms are things like you can't get your words out or you can't speak. Half of your body goes numb and feels like you can't move it, and part of your face might droop. It's just, you feel like you're having a stroke, actually. So that was me when the kids were little. And as you can imagine, I wasn't able to take care of them, if I was having an aura like that. Plus, I knew if I would get a really bad aura like that, I was in for a doozy of a migraine. So now, one of the things that has happened since, before I tell you about journaling, the other thing that I wanted to just quickly mention is that I've learned a lot because I had to, right? Because it was my experience. Now, about 3 years ago, I had the experience to really learn about neuroplasticity, which we're also going to talk about in just a moment. Neuroplasticity, or being able to change the brain, I learned after having a severe car accident. I was in a coma for a few days and had to sort of relearn everything. And I used a lot of the tools that I have learned over the years, some of which I'll share with you today on this webinar, and it really helped me get my brain back. I don't think really anyone expected me to get my brain back as quickly as I did. So it's sort of, that's the realm that I'm coming from, and I feel like in one way, I feel like it's sort of my responsibility. I had to prove it could be done to beat the migraines because I don't have chronic migraines anymore. With some of the things that I'll share with you today have really helped. I don't take medication anymore. And also, you can have your brain back by making new neural pathways in your brain. So I always encourage people to start with journaling their migraines, but I want them to journal effectively because how most people are taught to journal their headaches is not really very effective in terms of the benefit that they get because it actually may be making their headaches worse. So how people are generally taught is, and this is how I was taught years ago, is what are your migraines like? Give them rate them on a scale of, say, 0 to 10. What's going on? Like, what are you eating? What's the weather like? What foods did you eat? Look for things that trigger your headaches. And that's why we're always told by healthcare providers to journal our headaches so that we can see if there are any patterns, because that's a cue into how to treat them. And what else is going on in your outer world? The thing that people don't always pay much attention to is, besides the food and the weather, is, what were they doing in their day? Were they working all day? Were they at home relaxing? Were they doing something different? Routine is very important to our bodies, especially those of us with migraine headaches, because routine is important. And then this is something that I think is rarely ever talked about, but it's so critical, so important, is to focus on, when you're doing your journaling, the inner world. What are your thoughts and feelings? Is there stress in your day? What are you expecting? We get what we expect. So are you anticipating that you're going to wake up in the morning with a migraine or not? What is that inner world like? And then this last thing is something I would be willing to bet nobody ever tells you to journal about, and that's, what are your good days like? But that's so critical, because if we don't ever write about or pay attention or focus on the good days, then we're only focusing on the bad stuff. So I had a patient several years ago who, I was doing her headache history, and I was asking her what her days were like, and she said, on Wednesday I never get a migraine. And I said, what do you do on Wednesday? What's going on? And she said, well, I go bowling with my girlfriends. She was an older woman, and that's what they did for their social thing once a week. And she said, isn't that interesting? I never have a migraine on a Wednesday. It's because what are those good days like? And once she realized that, not that she was going to go bowling every day, but to do something fun every day, actually really helped her to get a handle on her daily headaches. So I believe that there are about 5 foundational concepts, and we're going to go through these today, that really help migraine sufferers, in addition or in place of sometimes their traditional medication. Lifestyle, nutrition, the impact of learned associations, the mind-body connection, and stress management. Hugely important. So let's talk about nutrition first. I believe that let's talk about lifestyle first. Nutrition is foundational. It's so important. Actually, we're going to talk on the next slide about it. But hydration is important. You got to water your brain. Our bodies are about 75 to 80% water. And if we don't water our brains or our bodies, we kind of look like those houseplants that we might forget to water sometimes. They look a little droopy. So hydration is really important. And then your brain needs rest. It really needs sleep, but it needs restorative sleep. That's the important part. Current research says that about 6 to 7 hours of restorative sleep is best, and the operative word here is restorative. Moving your body creates your own drugs. It's how you can make your own body's morphine, which is a great pain reliever. They're called endorphins, right? So you've got more drugs in your brain than any drug company could ever make. And moving your body, exercise, is one way to access those. And then managing stress in healthy ways. This is so important. It also gets its own slide. We're going to talk more in detail about that. So let's talk a little bit about advanced nutrition. I always say, if God made it, eat it. If not, maybe you should think twice. We weren't meant to have all those colors and preservatives and chemicals that are added to foods. So if you shop around the outside of the grocery store, that's where most of the fresh stuff is. Don't spend maybe as much time up and down the aisles, because that's where a lot of those chemicals are. They have to keep those foods sitting on the shelf for a long time. And then balancing your blood sugar is key. A stable blood sugar helps to prevent migraines. So how do you do that? By balancing your foods is one way. Proteins, carbs, and fats always together. And for breakfast, as an example, many people, eat dry cereal, and except for maybe Kashi Goleen is the only one I can think of, it has a good amount of protein. Most dry cereals don't have much protein, maybe 2 to 3 grams per serving. So if that's all you eat for breakfast in terms of the protein, you may not be getting enough, and that's usually why you're hungry by 10 o'clock. So eating in balance is hugely important. It also keeps your cortisol levels down, and that's helpful for stress, for all kinds of things. A lot of what we talk about today actually will help for a lot of things, not just migraine, because pain is pain, right? Whether it's emotional or physical pain, all of these things are applicable to pain in general. So balancing the blood sugar is really important. Avoiding chemicals, another big trigger for people. Artificial sweeteners is a very common one for people. Aspartame, which is NutraSweet is the trade name, can really affect migraines. And it's in a lot of things. And many healthcare providers will tell you to not have any caffeine or to limit caffeine. And for people who are sensitive to caffeine, I totally agree they shouldn't have any. But for people who aren't sensitive to it, a little bit's okay. But people don't realize how much a little bit is. I would say between 150 to 200 milligrams of caffeine for the day is probably okay for most people. Now, what does that equate to in coffee? Well, a 5-ounce cup of coffee, and if you know someone who has a 5-ounce cup, I'd love to meet them. But if you had a 5-ounce cup of coffee, there's about 130 to 160 milligrams of caffeine in that coffee, if it's drip coffee. And if it's maybe Starbucks or something, you have to add a little bit more. So notice how much caffeine the person is intaking. Most people have a bigger cup than 5 ounces, and they have more than 1 cup of coffee. And in a dark soft drink like a cola or something, there's about 50 milligrams of caffeine. So just be sensitive to how much that is. And then the elimination diet is, I think, the best way to find out if you have a sensitivity to foods. And what an elimination diet is taking a look at the foods you eat, and maybe through your journaling, or maybe just taking a guess, to eliminate certain foods that you think might be causing a problem for migraines. And then get rid of them for a while, at least 2 weeks, longer if you can. But it takes about 2 weeks for all of that stuff to leave your body completely. So I would give it at least 2 weeks. And then when you add the foods back, say you eliminated 3 different foods, add them back one at a time, not all together. It's kind of like giving a new baby food for the first time. We don't give them all the food at once. We see how they tolerate one and then add another and add another. And I think it's a really good way to see if you are sensitive to anything. Now, for people who have daily headaches, then I would encourage them to look at things that they eat every day, like gluten, which is wheat products. Almost everybody eats that every day. And so maybe that's something that they're sensitive to. Gluten, dairy, and soy are very common problems for people. And then I'm an advocate of a good multivitamin mineral. Cover those basics first. Number one, we don't eat the way we should most of the time. And number two, food just isn't as good as it used to be 100 years ago because of the depletion of minerals from the soil and things like that through commercial fertilization. So a good multivitamin, a good one would be made to be taken twice a day, and make sure you get minerals in there too, especially minerals like magnesium. It's called the relaxation mineral. It's very important for people with migraines. And the learned associations that we have is so critical. Traumatic experiences leave an imprint on the brain. There's just no two ways about it. Everything is in there, the good, the bad, the ugly, all of it. And then our thoughts and emotions are a major factor in migraine. Neural pathways, or I like to call them when I'm working with a client, I like to call them grooves in the brain, or ruts. These little grooves are created in the brain, and you can't really undo them, but you can create new pathways around them, maybe little detours. So we can retrain the brain. That's the key. And we'll talk about some things on today's webinar on how you can help people learn to start retraining their brain. The mind-body connection is huge. This, I think, is the core of everything. And our mind is kind of like an iceberg. That little bit on top above the water that we can see is kind of like our conscious mind. Most closely related to the left hemisphere of the brain, and it's what we know is there. It's what we know we're thinking. But there's that huge piece of the iceberg underneath the surface of the water, the part that we can't see, that we don't even know is there sometimes. That's really like our subconscious mind. That's where everything is. The good, the bad, the ugly, all of it. It's most closely related to the right hemisphere of our brain. Everything is in there. The other thing is we experience what we focus on. So a good example of this is someone who is thinking about getting pregnant or having a baby. They're out in the community, and because they're focused on that, pretty soon they notice every other pregnant woman in the community. They never realized that there were so many pregnant people out there. It's a good example, a silly one maybe, but a good example of how we see, we experience what we focus on. And then very often, symptoms are trying to tell us something. It's kind of like the oil light that's going on in the car. And almost always, especially with people with a long history of migraine or chronic migraine, there's almost always something underneath the migraine, underneath that pain. And getting at that is where you can make real shifts and real changes. And there is true power in affirmations. And people sometimes kind of poo-poo affirmations, but if they're done right, they are so powerful. So we're going to talk more about that at the end of today. Now, stress management is critically important, and we can't live without it, right? Stress is everywhere. To experience stress is really to experience life. But you have to manage it in healthy ways, and that's what makes the difference. Now, the moments just before people fall asleep, I think this is so critical. Of all the time throughout the day, those last few moments before you fall asleep are so critical. Because as you drift off to sleep, the conscious mind, that left side of the brain, right, the little part of the iceberg, goes to sleep. But that subconscious mind, that huge piece where everything is, doesn't go to sleep. Otherwise, we'd stop breathing. So when you drift off to sleep, whatever you're thinking about in those last few moments is what your subconscious mind has to chew on all night. So for people, say, who watch the news right before they go to bed, the news doesn't always have a lot of nice things on. I mean, they're kind of scary, traumatic things. That's not really what you want to go to bed with. So a way to counteract that, if you really want to watch the news, is to think of something good before you fall asleep. It's a great time to do gratitude, to think about your day or your life in general, or something in the world that you're grateful for. And everyone has something to be grateful for. I mean, just the simple act of being able to breathe is something to be grateful for. Very often we take those mundane things for granted, but yet there are people who can't breathe, right? Or it is an effort to breathe. Maybe they have COPD or something. And it's also a good time to do forgiveness, but gratitude can really change your life. Because you have to remember that the law of attraction, or whatever you want to call it, but that rule, right? That law of attraction is at work all the time. It doesn't just work when you want it to. It's always working. So every thought is a prayer, actually. So notice the kinds of thoughts you have. Notice what you're praying for, especially as you fall asleep. It's so critical to managing stress in a healthier way. Now, I promised you some tools that you could share with your clients. You know, I think for those of you who counsel or teach people or do therapy in any way with clients, and really we all do, right? We're all counseling people, whether we're counselors or not. I think it's our responsibility to give them hope, to inspire them, to let them know that they don't have to live like this. I mean, that's what a lot of people who suffer with migraines think, that it's their lot in life, that it's just their cross to bear, and there's nothing that can be done. Many people that I see in my practice or talk with now in my virtual practice have been told there's nothing that can be done. Well, that's not true, because you know, it is what it is. The pain is what it is, whether it's migraine or some other type of pain. But the suffering, that's the optional part, and that's something that we can do something about. And affirmations is a really good tool that I use with people all the time. But they have to do it the right way. So we'll talk about what's a really powerful way to do affirmations. You have to remember what part of your mind you're talking to when you're doing an affirmation. You're really talking to the subconscious mind. And the subconscious mind is very much like talking to a small child. Now, if an example is, if you ever said to a little one, maybe ages 3 to 5, tomorrow we're going to the zoo, you would probably have regretted it, because every 5 minutes it would be, are we going? Are we going? Is it zoo time? Is it tomorrow yet? Are we there yet? Little kids do not understand the future, and neither does your subconscious mind. So you always want to be in present tense. I am, I have, I feel, I know is much better than I will or I want, because the subconscious mind just doesn't understand that. And the other thing that little children don't understand until we teach them is what the word no means, right? We say don't do that, and what they actually hear is do that. Really, that's what they hear. And so you have to remember that the subconscious mind is very much like that. So I would avoid those negative words. So focus on what you want, use present tense, and then avoid negative words. So here are some examples. My body is healthy and strong. I deserve to have the life I want. I enjoy my life and feel great. I love and accept myself. Now, even if the person isn't there yet, that's fine, because affirmations really work best when you're fantasizing, daydreaming, imagining that you're in that future person that you want to be. That's really when they have the power, because you have to get excited about it and get the emotion in there. So saying this enough to yourself over and over again is going to help, but you got to get the feeling in there. So there are some ways to really enhance how powerful those affirmations can get into the subconscious mind. One technique is using what I like to call the 2-minute relaxation technique. It is actually a brain gym technique, and I sort of modified it a little bit with a few other things, and I call it the 2-minute relaxation technique. And if you want the video to this, by the way, you can go to my BonnieGroessl.com site, and it's one of the free things on there. So you can just click on that, and you can watch the video. But let me explain to you how to do it. So I always, when I'm teaching this to clients, I have them sitting down, because I don't want anybody tipping over, right? And I ask them to cross their ankles, and their arms go out in front of them, palms facing outward, and I have them cross those and interlock their fingers and rest them in their lap. And people should always modify for their comfort. If they have shoulder or hip issues and they can't get into this position comfortably, that's fine. Just maybe get close, cross something if they can. And you know, the brain doesn't really know the difference between what's real and what you imagine anyway, right? That's why stress is so harmful to us. So just imagine that they're in this position, and it will still work. Then the next part, and you can't see this on the image you're looking at, but the next part is just gently place your tongue right behind your upper front teeth on the roof of your mouth. Just rest it there. It might already be there. Breathe in through the nose, and then exhale nice and long. Any way you want. Mouth open, mouth closed, doesn't matter. Keep your tongue up there if you can, but let all the air out. When you breathe in this manner, it really activates that parasympathetic nervous system and is a really good relaxation tool, which is why it only takes a minute or two to have a really nice relaxation benefit from a technique like this. Now, how this works with affirmations is when you're sitting in this position, or even imagining that you're sitting in this position, you're crossing something, right? What that does is it allows the left hemisphere to talk much better to the right hemisphere. So you have this band of fibers down the center of your brain between the two hemispheres. It's called the corpus callosum. I always tell clients to think of that as the bridge. When the bridge is closed, nothing's getting through. That's why when you're frustrated with something, sometimes you can't even get your words out. It's because nothing's getting through. What you want to say is in the left hemisphere, but where you need to get it from is in the right. So when you cross your body, or you imagine that you are in this way, and you use an affirmation, you're saying that in the left hemisphere, which is the conscious mind. So let's use the example of I feel healthy and strong. I feel healthy and strong. I feel healthy and strong. I encourage people to just pick one at a time and keep repeating it over and over and over and over and over again while they're sitting in this position. Because with that bridge open, the messages are going to get over into the subconscious mind much better. And plus, you add the relaxation piece in there, and it really helps it to get into that subconscious mind. So the 2-minute relaxation technique is powerful. The other thing that's kind of going on as a person is sitting in this position and the tongue is behind the upper front teeth, you're probably wondering why. In Eastern medicine, if you look at meridian lines, which is where acupuncture points are found, there are 2 main meridian lines in the center of your body. It runs from the roof of your mouth, goes up and over your head, down your spine, picks up to the other one, comes all the way back up, but there's a little space right behind your upper front teeth. So when you put your tongue there, it closes that circuit. And all of that energy that you're moving as you're breathing, all of that is staying inside for you. And so it's a really good relaxation technique and a way to add power to your affirmations. Now, Louise Hay coined the term mirror work. And what mirror work is looking in, you've probably heard of this before, looking in the mirror, and I don't mean just looking in the mirror, I mean eye to eye, looking at yourself in the mirror. and using your affirmations. It's a great way to do affirmations. So, I mean, how often do we look at in the mirror at ourselves and we think something derogatory, right? Those are affirmations too. So people should be aware of what they're thinking when they're looking at themselves in the mirror. So I would say use those affirmations as you're doing mirror work. Now, some guidelines that I use with patients. Guidelines that I use with patients, they're pretty simple actually. And the reason they're simple is because I really encourage people to use a simple path. The simplest path is the best. Many times we make things way too complicated and then it doesn't work so well. So if it's simple and it feels good to them, I say go with it. Follow their intuition. I always encourage people to listen to their body because sometimes the symptoms that we're getting, like the migraine headache, is really our ally. It's really telling us we need to stop. This happens to me all the time. If I'm on the computer too long or I'm working at something too hard, I'll start to get a little twinge of a headache. And if I listen and stop doing what I'm doing and go do something else or relax, then the headache never comes. But if I don't listen to my body, then I'll get a migraine. So I always encourage people to follow their intuition. And then this piece, I think, is the most important piece. People have to love themselves enough to take care of themselves. So that is hugely important. And I think in particular, and I don't mean to be stereotypical here, but I think women are worse at this than men are. You have to love yourself first. I mean, how often do we take care of everybody else first? And maybe if there's any time left over, then there's something for us. But I think we need to be at the top of our pile. And then you have to believe. You have to believe that you can have a better life. This doesn't have to be this way. So I usually ask people the miracle question. And the miracle question is simply, and you may do this with your clients as well, if a miracle happened tonight while you were sleeping, and when you woke up, poof, life was the way you wanted it, your miracle life. I ask people what that would be like. What would they be doing? Who would be there, if anyone? And most importantly, how would they feel? And then I encourage them to imagine that. And we play a little bit with this when I'm dealing with them. Imagine it, write about it. Pretend you're already there. Now, these are great things to do affirmations about because they have to first know what they want, right? So the miracle question I have found to be very helpful in working with clients, whether it's an in-person thing or I'm on the phone with them. And then I have some resources that I share with people as well. And you can find pretty much everything on my main website, which is just bonniegroessl.com, and I think it's there for you on your screen. The book and the CDs were mentioned before. I do have the Bridge to Health, which is the name of my practice, on Facebook, so I do an inspirational thought for the day as well as some other things. And then I have a radio show that was mentioned before, I think, as well. And I actually have a show tomorrow at 4 p.m. Central Time, and it's going to be talking about the importance of self-love and how important it is to be first on your list. So if anyone's interested in listening to that, you can certainly join us. That'd be awesome. And all of the shows are recorded and archived, so you can always get any of them later at some other time as well. And my YouTube channel, I think Ed mentioned that before, and I do my blog. Lately I've been doing my blog weekly, and it's been sort of coinciding with the radio show, same type of topic. So those are just some resources. If people want to access more individual coaching from me, personal coaching, I do have some coaching programs, and if they just go to bonniegroessl.com, then they click on, I think it's coaching programs, and they can get all the details of that there. So I share with them the resources that I have for them and help empower them to see the resources that they have in themselves. And that's, I think, what it's really all about. So I think we'll open it up for questions after Ed does his next little piece, and otherwise I think I'm okay for now.
Bonnie, each time you share, I am energized, I am inspired to have, focused lifestyle changes, to include affirmations in my daily life. I love your idea of doing mirror work, the 2-minute relaxation technique as a way to really integrate all sides of the brain, the mind, the body, the spirit, and then your miracle question. I can go on and on with sharing how you can inspire and how we can help people to rewire what fires together, wires together. So to reorientate, to have a different relationship with what you're experiencing in terms of migraines and taking charge. We have so much that we can empower ourselves with to turn the corner, to have significant relief and enjoy life so much more. So, Bonnie, as always, you've hit the ball right out of the ballpark, and I thank you so much.
Oh, you're welcome. It was my pleasure. It's an honor to be here.
Well, now we have a chance for you as participants to ask questions in the chat area. So, please feel free to ask anything, and I'm going to turn it over to Heather Butts now, our producer, because not only do both Heather and I have questions, but for folks who couldn't make it tonight, we've had some questions that have been asked, so we'll definitely be on for a little while longer. And if your question has not been answered, please feel free to reach out to Bonnie, and all of her resources and the ways to connect with her are on your current slide right now. So, Heather Butts, I'd like to turn it over to you from Learn for Life Consulting, and welcome back, Heather. And do you have any questions?
Yes, I do. So, Bonnie, maybe you could talk to us about what someone who suffers from migraines, what they can do to either divert or alleviate a migraine in the prodrome state.
Oh, great question. Not everyone can identify a prodrome each time. However, if they can, it's an awesome opportunity, because they have a window of opportunity where they can maybe avert the headache and never have it. And so drinking, the simple stuff, drinking enough water, make sure your blood sugar is balanced. And then, I had a patient, it was kind of interesting. She's a little bit older person, and she had chronic headaches for years, 15, 20 years. And we worked on her identifying before the headache was coming, as it was coming. And what she did was she drank 2 glasses of water right away. And she said, and you know what? Most of the time the headache never came. So for her, now everybody's different, but for her, dehydration was part of that. And so just hydrating herself better helped. And then there are things like you could take maybe some over-the-counter medication like an Advil or something like that. If you catch it early enough, it's enough to do it, and you don't need any other medication then. So if you have that warning time, I certainly encourage people to use it.
Thank you so much.
And so this is Ed Glauser again, your host from the Mind Body Medicine Network. And I have a question that has really been on my mind, Bonnie, and I'd like to ask you, how much is trauma? This is either or both physical trauma, psychological trauma. How much is it a factor in precipitating migraines subconsciously, and then at being reinforced through learned neural pathways that then eventually lead to migraines? In every client that I've counseled who also has migraines, there is usually some trauma background. Can you share a little bit about your thoughts about that?
Great question.
Yeah, it's a great question. That I see that a lot too, and there's almost always something underneath the pain. It's either a trauma, PTSD is common, some sort of other trauma, or a limiting belief. Like an example of a limiting belief that you wouldn't think would really cause a problem. But say I've had patients like this. My mother had migraines, and so I know it's hereditary, so I'm going to have them too. That's a limiting belief. And it's not just with migraines, but with all kinds of things that we think are hereditary, and so obviously we have to get them. And so it's almost always underneath. And what I like to work with, and I'm sure many of our listeners do too, is what's underneath. That trauma that the ways that we can change the brain, that we can, heal some of those things from the past. I always say to people, you're never too old to change your childhood, ever. Because really, it is what it is, but how you remember it, what you take from it, how it affects you today, you can change. And so changing what's underneath that migraine is huge. And I think trauma is a major factor. And whether it's physical or emotional abuse or sexual abuse or something a teacher said to them in school, or the fact that their mother had migraine so they think they have to, there's something.
Bonnie, this is Heather Butts. I just wanted to follow up with that because as you know, I have a radio show too, and one of the hosts, his name is Dr. Ed James, and he talks a lot about the cycle of families perpetuating beliefs. He talks a lot about it in terms of hypertension and diabetes, and families believing that because, my mother had diabetes or has hypertension, I will get it. And really what the underlying issue is more it's almost sort of like groupthink within a family, and how you have to break that cycle in order to get over it. And it seems like you're saying something very, very unique and very similar in terms of breaking the cycle of a family believing that because one member, suffers, that therefore everybody is going to have to. Right.
And sometimes they don't feel like they're part of the family if they don't suffer, It's like, oh, gosh, maybe I should because this is the thing to do. It's a different way to look at it, but at some level, probably subconsciously, I'm sure people don't consciously say that, but subconsciously, there's a part of them that feels that they need to fit this picture.
Mm-hmm. Right.
Bonnie, this is Ed Glauser again. I had a question from someone who couldn't attend the webinar tonight, but they asked, how receptive have you found the traditional medical community in addressing the psychosocial or holistic aspects of migraine control with their patients, or is it primarily an approach where these biomedical clinicians just primarily focus on medication management with the exclusion or just significantly minimizing how to address migraines with an integrative approach?
Well, that's a good question, and it depends, but I also think it's changing, and for the better, too. It depends because I think, and I don't mean to be, stereotyping at all, but general practitioners, the primary care provider who's not a neurologist or not a headache specialist or not a pain specialist, sometimes are not as aware, or maybe they don't have the experience. I mean, there's a huge number of headache specialists, about 75%, I think, that have either personal or family history, and by family history I mean like their spouse has migraines, or maybe their mother did or whatever, and they remember how mom was when they were a kid. So they have some experience with it to understand how significant it is, and they're generally more in tune to someone, to things like that I would do. In my experience, the neurologists who refer to me truly appreciate what I do because I can get their patients better. They focus on the assessment, diagnosis, the traditional treatments and meds, which I don't really want to do. And then they refer to me, the mind-body stuff, because they don't have time to do it. And because now I'm in private practice, I don't have productivity issues where they do, and they don't have the time to spend with people, yet they see the importance. And maybe it's, maybe my perception is a bit skewed because Green Bay is a relatively small community, and I had the advantage of working with a lot of the docs before when I was at the clinic, and they really came to see me as the headache expert, because the stuff I was using for my headaches was also working with patients. And so they really gave me a lot of latitude. But when I went into private practice, actually most of my referrals came from neurologists I had never worked with before, but I made one or two or whatever their patients better. They just tried it, and it was great because they thought I could do no wrong, because they didn't want to deal with it, and they knew that I could do it. And usually I see patients that have been everywhere. They've been every clinic, every headache, diamond clinic, all that stuff. try all the medications and they're still not better. So very often I will get people sort of at the end of the line. And sometimes it's the last resort, not just for the healthcare providers, and last resort, but also from the patient's perspective sometimes. Now, this is interesting because to do this work, to really get better, they got to do the work. I mean, they have to do the homework. They have to make some changes. I mean, I've had people, change how they eat. They don't do diet soda anymore. Maybe they got a different job. Maybe, but to really change their life. And not everyone is willing to do that. And so those people who are, that's where you get to that stuff that's underneath, whether it's trauma that's happened in their past or whether it's just some limiting belief or something they're hanging on to from their past. But generally they have to do the work. And so, it's been wonderful for me in this community because people kind of see me as the expert, but I honestly don't know how it would be if I would move somewhere else and try to set up shop. I'm not sure.
From where you're at, that sounds very encouraging and lets me know that there are many inroads that are going to be receptive where we can get traditional medical clinicians referring to the more integrative clinicians. So thank you so much for answering that question.
Oh, you bet. And sometimes it has to be the patient who brings it up the first time. But I tell you what, you help one person, you have one success story, and all of a sudden you're gold, because they think you can do miracles with anybody then. So really it only takes one. And sometimes the patient or the client has to approach them. And I always tell people if you want to try things outside the traditional realm and your healthcare provider says no, then you find a different healthcare provider.
Wonderful. Very empowering. Heather, do we have other questions?
Yes. Bonnie, it seems that when what you were discussing is that migraines and depression and anxiety go hand in hand. And maybe you could talk a little bit about the exacerbation of migraines because an individual does start to get very depressed because they are suffering and vice versa.
Oh, absolutely. There's really no difference between emotional and physical pain. I mean, the neural pathways and the things that happen, in your brain really are pretty similar. And when we have physical pain, our anxiety level always goes up. It doesn't really matter what kind of physical pain, the anxiety level always goes up. And so to help bring down that physical pain, the perception of that pain, it's helpful to take the anxiety level down because that will make them feel better. They'll perceive less pain. That's why relaxation techniques are so helpful. And then for people who are, say, have depression issues, and they already have that neural pathway, that groove, right, the depression groove, and they may very often expect the worst to happen as opposed to the best to happen. And we get what we expect, So in a case like that with a client, I would really work on getting their detours around those grooves and getting them focusing and expecting different things. Because someone who has struggled with depression or really any kind of pain, really, you get to a point where they just expect it, and it's who they become. And I see that happen a lot with people with chronic pain. I've been doing this for a number of years, and some people it becomes their identity. And that's not that you can't change that, but it's a little bit more work for them to change that. And I don't know if that answers your question, but
completely. Absolutely. Thank you.
So Heather and Bonnie, we have about 10, 15 minutes left, and Heather, I think you have some other questions and would love for you to ask away.
Okay. Okay, that would be wonderful. I find the topic to be really fascinating, and you did such a beautiful job, Bonnie. Another question has to do with managing stress, and I was really taken by that the painting, the drawing that you have in your presentation, because I would imagine, especially a lot of parents who are dealing with young children, trying to balance having the young children and their needs and their own pain is difficult, to say the least. And so maybe you could talk a little bit about managing, stress and young children and a family while you're dealing with the pain of a migraine.
Okay. Really a lot of the things that we talked about, too many things probably to cover yet in this webinar during the questions, but some of the simple things that everybody can do. I mean, you have to breathe anyway, right? So even in that situation, just breathing in the right way. Breath work can be very helpful. And if they can't get into that position that I showed in the 2-minute relaxation technique, that's fine. If they're able to put their tongue up behind their upper front teeth, that's better yet. But at least breathe in through the nose and really let a nice long exhale. That really activates that parasympathetic nervous system and will help to bring that anxiety, the stress level, that whole piece down a notch. And then, make sure that they, if they're not in a headache and watching little children at the time, and they're able to, get outside or do something else. I'm doing kind of a little experiment with myself on associations in the brain, learned associations, and that I am trying to get away from any medication except for maybe an Advil here or there when I do get a headache, because I don't get them very often anymore, but I still do. And I would always, take an Advil or something, and maybe sometimes have a migraine medicine and an ice pack and lie down, because I thought, okay, that usually works. Well, it hadn't been working so well lately, so I thought, all right, I'm going to try this little experiment. Maybe I have a learned association in that, if I do these things, it means I have a migraine. So I do that for about 20 to 30 minutes until I think the Advil or whatever I take will have worked. And then if I still have a headache, I go out for a run. And this has happened 3 times now, because I've only been able to test it 3 times, but each time my headache has gone away because I'm using my own drugs. So sometimes if they're able to, and it's different certainly if they have little kids that they have to watch and they can't leave and all of that, but if you can break the pattern in some way, sometimes that's helpful. And we have to breathe anyway, so that's something that everybody should be able to do. Sometimes with migraine, you get that where your nose is really stuffy, it's because of the turbinates are edematous at that time, and it's hard to breathe through your nose. Just breathing with a nice long exhale would be better than not. So those are some simple things, but we could spend a whole day on dealing with stress and migraines and stuff. But
yes. Ed, I have 2 more questions, if that's okay.
Absolutely. Fire away.
Wonderful. All right, so the first of the questions has to do with possibly keeping a food diary, because I was intrigued by the notion that certain foods either can trigger or can help, like the story you told about hydration, can help with migraines. And do you recommend that individuals keep some sort of a food diary, or maybe even the story you told about running an activity diary to sort of see where triggers are or what helps them?
I think it's good information to see, what triggers there might be, what helps them, if there's a pattern of any kind. And doing an elimination diet, like I mentioned earlier, is probably, I think, the best way to see if they have a sensitivity to any foods. It's more specific than any blood test or lab value that we have available to us. So that would be really good for that reason. The only caveat with that, and I do think that it's a good thing for people to do, but I don't want people to focus on a certain food causing their headache too much, because a good example, I had a patient one time who saw that chocolate was a trigger for her, so she never had any chocolate. And pretty soon, because she had thought about it so much, pretty soon the smell of chocolate or someone talking about chocolate gave her a migraine. So she didn't ingest the chocolate. It was a learned association. So that's the caveat with journaling the food thing. I mean, I think it's a good thing to do because you can learn a lot, but just not to get caught up in this equals this. you know.
Absolutely. And the final question is sort of ending on a positive note. I actually have somebody who wanted me to ask you a question, which has to do with sort of having the positive life once you sort of overcome suffering from a migraine, and thought that your story was very uplifting. And so just wanted to sort of hear something about how you can overcome the pain and debilitation, and that there is a light at the end of the tunnel. So more sort of just wanted to hear your words of inspiration regarding that.
Oh, yeah, it's, you know, it can be done. You know, I had the situation with, I had chronic headaches, chronic migraine, and it wasn't really from rebound. For me, it was stress, was probably one of the biggest triggers. And once I changed things in my life, I went from taking, 360 milligrams of propranolol, which is a huge amount, every day, to nothing. And, you know, I have headaches once in a while now, but not every day or every other day like I used to. And the biggest thing I changed in my life was, well, I don't encourage people to get divorced, but I happened to change my life in that way. And so the stress was much different. And so it is possible. And then when I had my brain injury, it was just another kind of aha. And, you know, as I am recovering from my injury and, you know, relearning everything, I thought, as I'm sitting in my meditation time and my quiet time, I'm saying, you know, I'm asking my, you know, guide, angels, God, whatever people believe in, why did I get better so fast? And the message that came to me, it was so profound, but I'll never forget it. And the message was, because you had to prove it could be done. And I want to share that with people because it can be done. It's like the guy, and I should have looked up his name, but the guy back years ago who was the first person to run the 4-minute mile. Until that time, no one had been able to run a 4-minute mile until he did. And now all kinds of people break that record. So somebody had to prove it could be done. So there is hope. I mean, if I can do it, anybody can do it. And there's nothing special about me. It's just that I think I was meant to do this. And that's probably why I had these experiences. But I think that anybody can have a better life. The suffering is always optional. That we can choose.
Thank you so much, Bonnie. Oh, Bonnie, you know what? I do have one more quick question for you. It has to do with the cycle of rescue medication and rebound syndromes that you mentioned. Could you just speak a little bit more to that? Because I have a feeling that probably, you know, that a lot of people who I know who suffer from migraines think that if I just take enough medication, that'll make everything better. And it sounds like that's probably not the best, you know, the best course.
Well, and most people, and maybe this is speaking to generally, but most people, I think, with chronic daily headache, either it's been a transformed migraine, and it's just, you know, the kindling effect that I talked about earlier, or it's rebound. And there are so many people. In fact, I was just reading something on a forum, because I subscribe to some of those, about this person who was taking, you know, tons and tons of medication, but it was because her doctor was telling her to, and she's got headaches all the time. And I thought, oh gosh, you know, I wish I could intervene. But if you take something for pain, doesn't matter what it is, if it's an over-the-counter or Fioricet or the barbiturates, Fioricet, Fiorinol, those are probably the worst, because doctors years ago, they used to prescribe more of that, and people would take them too much of the time. And to get out of rebound, you have to stop taking the medicine. With something like Fiorinol or Fioricet, the barbiturates, you don't want to stop that cold turkey, certainly, because it can lead to seizure issues and all kinds of horrible things. Sometimes we'd have to hospitalize people to just wean them off their medicine. But for the over-the-counters, you can pretty much stop cold turkey. And generally what we do is put people on a different, like a preventative medicine, which isn't going to work as well because they're in rebound, but we still put them on something to help buffer that a little bit. And then what I do with clients is really help them to manage it in other ways. Make your own drugs. We have all kinds of drugs in our brain. And, eat well enough, sleep well enough, all those things. Be really good with everything. And sort of just hold their hand through that detox period. Now, for over-the-counter medicines, it only takes about 3 to 7 days, maybe, at the most 7 days. With barbiturates, it can take 12 weeks. So big difference in terms of the kind of medicine that got you into rebound trouble. And more is not better. Excedrin is probably the number one because of the caffeine piece, too.
Mm-hmm.
So it's a dangerous thing, and people just don't realize that sometimes.
I think that's the questions, Ed.
Well, Heather Butts, Bonnie Groessl, thank you so much for such a wonderful discussion.